named among the 100 most influential people by the Times of London. He was one of the vaccine's biggest supporters at the beginning, going on television many times in the year 2020, 2021 to promote, criticize vaccine-hesitant crowd as anti-vaxxer propaganda. But then a couple of things happened. His father, also a cardiologist, was the VP of the British Medical Association, suffered a very shocking, unexplained cardiac death. His post-mortem findings found that the mRNA vaccine that he had just taken caused him to go into cardiac arrest. That, along with the unprecedented global spike in young people having unexpected cardiac arrest, something we've been covering here deeply on this show, heart failures, myocarditis, strokes, all of this moved him to action. And Dr. Malhotra joins me now. Doctor, good to have you on the show. Is it safe to say that you're on a mission now to stop these vaccines from being administered, a total cessation of these vaccines?
Yes, Clayton. So, I mean, the reality is this: all of this stuff that you discussed certainly played into my making a decision to really critically analyze the data on the vaccines, looking at both benefit and harms. And then I published a peer-reviewed article a couple of months ago in the International Journal of Insulin Resistance, which is open access. It's a journal, a medical journal that doesn't get any money from pharma. And that's one of the reasons I published it there. And what I ultimately concluded, and I'll break it down for you in a second, is that it needs to be a complete total cessation for everybody of these COVID mRNA vaccines, specifically vaccines that come from Pfizer and Moderna, because the ongoing benefit is close to non-existent. But more concerningly, we have very good quality level of data now showing that the harms are very common, and those serious harms in particular, and you've alluded to some of them already, such as cardiac arrests, are clearly causal by the vaccine. And the reason I say they're causal, and again, I'm going to give the information in a way that people understand in a second, is we have what we call randomized controlled trial data. We have mechanistic data to understand how this can happen, how the spike protein from the vaccine can cause heart problems, but also problems in other parts of the body. We have observational data, and this comes from the pharmacovigilance, if you like, the yellow card reporting scheme in the UK. You have something called VAERS in the United States, which is unprecedented in terms of the reports.
Right.
And last but not least, we now have confirmatory autopsy findings that have shown in many cases, certainly people who have sudden cardiac death or heart attacks within a few weeks of the vaccine, those post-mortem findings give clear evidence that the cause is the vaccine. So the evidence is overwhelming. The question is, what are those benefits and harms? Now, when in ethical evidence-based medical practice, and I'm very much a proponent of evidence-based medicine and giving information to patients in a complete, honest, transparent way so they can make informed decisions, we are told to always give patients information, ideally, if that's available, in what we call absolute benefit terms. So what's the absolute benefit of this particular drug for you for an outcome such as preventing a heart attack? We can talk about statins, for example. And what are the potential harms based upon the totality of evidence? And that's what I tried to do when I looked at this COVID mRNA vaccine. So if you look at certainly now, the Omicron wave that's going on, we analyzed data in the UK, real world data, looking at vaccinated versus unvaccinated. If you're over 80, which is the highest risk group, just to start from there, you have to vaccinate 7,300 people over 80, Clayton.
Yeah.
The younger you get, the bigger, the larger that number becomes. Now, in medicine, that kind of numbers needed to treat or vaccinate is astoundingly high. And normally you wouldn't recommend any drug on that level of benefit. It's so small, it's essentially close to non-existent. But what are the harms and what's the prevalence of those harms? So a very important, I think I would say groundbreaking article was published, a research paper was published in the journal Vaccine a couple of months ago. And it was co-authored by some of the world's most eminent medical scientists. And when I use the word eminent, I mean eminence of integrity. These are people who are independent of industry funding, but very good at what they do. And they include people like Peter Doshi, associate editor of the BMJ, Robert Kaplan from Stanford, Joseph Freyman, and who was a lead author. They were able to now go back to the original raw data or have access to more data from Pfizer and Moderna's original trials. We call those double-blinded randomized control trials on the vaccine. That actually were the pivotal trials that led to the regulators approving the vaccine and then the whole mass distribution of it. So this is really important because those trials cut out all sorts of what we call confounding factors that may distort the evidence. So this is as precise as we're going to get in terms of what the vaccine's doing. And what they found, there are two really important points here. One are the rate of serious adverse events. So this is hospitalization, disability, life-changing events. And this, of course, this is going to include things like heart attacks and cardiac arrests. The rate of those was 1 in 800. So for every 800 people vaccinated, there was one serious adverse event. The second part, which is, again, most disturbing, and this is, I think, for me, the smoking gun around the whole the distribution of these vaccines, is those trials revealed one was more likely to suffer a serious adverse event than to be hospitalized with COVID.
Wow.
What that means, Clayton, is, in essence, now that we know this, it suggests from the very beginning these vaccines should never have been approved in the first place. So what I'm trying to do is to get that information out. We're seeing ongoing harms. You know, I've managed many patients myself, and I don't know how to describe it, whether you just call it madness, criminal, even psychopathic in some ways, that we are collectively as a society, and there are lots of culprits involved, more system failures than individuals, that we are still, you know, asking people and telling people to have these boosters. It's madness, absolute madness, and it needs to stop, because all we're doing now is causing harm with no benefit.
It's really disturbing. Every night on our show, you know, we broadcast, we have 30, 40,000 people watching us live. And when we cover these stories, I'll see people in the comments just telling us live, I lost my mom right after she took the shot. I lost my sister right after she took the shot. My son had a heart attack. My young son had a heart attack right after taking the shot. I mean, and you're not allowed to talk about this. I mean, this is blocked on platforms. This is banned. I want to get into that in just a second. But one thing that came up this week, Doctor, was your name. Your name came up in the halls of Parliament this week. Member of Parliament Andrew Bridgen gave an impassioned speech earlier this week that we covered here on the show, and calling for the immediate suspension of the mRNA vaccines in the UK. Your thoughts on his speech, and also the bombshell that he dropped about, which came towards the end of his speech, which my jaw dropped when he talked about a member of I think the Heart Association in Britain was actively covering up this data. They knew they were having these adverse effects. Can you talk a little bit about that? Your thoughts on the speech?
Yeah, sure. Absolutely, Clayton. So as somebody that has been an activist for improving quality care, helping patients make better decisions, helping doctors to have more clean information, and I've been doing that for years, I also realized that in that role of what I was doing in my advocacy role, that we have to hit the policymakers. So I was actually a couple of months ago invited, shortly after my paper was published, to give a talk in Parliament. And Andrew Bridgen was one of the MPs that attended. And the data was so clear that I presented over almost an hour that for them and the other MPs that were there, including actually another MP called Danny Kruger, who was David Cameron, our former Prime Minister's speechwriter. Now Danny Kruger's an MP. They were absolutely, you could tell that the penny had dropped for them. And they both went forward then to try and propagate the information I'd given them, because I think it all made sense, because I put all the jigsaw together. I didn't just break down the data. I talked about all the system failures that led to this problem in the first place and how people got duped. And I think once all that was covered, they knew what to do. So Andrew then actually, he contacted me last week and said that this was coming up and whether I'd attend. So I went there live to witness the event. And of course, I, counseled him, and he asked for my advice on some of the content of his speech, which I think was just very, very powerful. But within that speech, you're right, he did mention something which is extremely disturbing, but maybe not surprising, knowing that there has historically been, I know this is a big issue in the States, it's been an issue in the UK. A few years ago, one of the former editors of the BMJ said that there is a culture, unfortunately, of research misconduct in British institutions being covered up. And so this is already on that background. And then Andrew mentioned that somebody linked in a very senior leadership role to the British Heart Foundation, a whistleblower had essentially conveyed information to him that there was an acknowledgement that within that research team, that there was an acknowledgement, accidentally they'd found that the COVID mRNA vaccine was causing heart inflammation, coronary artery inflammation, but had then decided to not publish those findings because they were concerned about losing research money from pharma. And I think that brings us on to really the root cause of all of these problems and this misinformation is that what's really driving this. And it's important to understand that because any solutions we offer, Clayton, moving forward, will be flawed unless we identify the root cause. And the root cause is that we have these very powerful, big multinational corporations, in this case pharma, whose legal obligation is to produce profit for their shareholders, not to give you the best treatment, who have had increasing both visible and invisible unchecked power over the last few decades, probably in many ways related to political policies, neoliberal economic model started by Ronald Reagan, also perpetuated in this country by Margaret Thatcher, that now means they have more and more power than they've ever had over universities funding research, over lobbying, over politicians in the States, for example. I mean, it's extraordinary. And what's happened is they themselves carry out, they've got historically, unfortunately, and I don't say this in an alarmist way, it's absolutely factually correct, their business model is essentially fraud. And when I say fraud, I mean deliberate deception in order to make money. And there's lots of evidence of all this fraud that most of these companies have created and got away with over the years and then didn't make nothing really changed in the system to stop them committing those frauds again. So once people understand that they are there as a machine to basically make money and really at any cost, and I used this word psychopathic earlier, that isn't my terminology. The preeminent expert, forensic psychologist Dr. Robert Hare, in the book The Corporation, written by Joel Buchanan, the documentary, he himself was involved in actually the original criteria, the International Psychiatric Criteria for Psychopath. He describes that these corporations, and even references Big Pharma, quite often behave and fulfill the diagnostic criteria for psychopathy, right?
Wow.
So what does that mean? Deliberate deception in order to make money, deceitfulness, continued lying, unconcern, callous disconcern for the safety of others. That's some of the characteristics of what a psychopath is. He says the entity, not the individuals within them, but the system, right? The entity that is Big Pharma often behaves like that. So I think once you understand the root cause of the problem, and this also includes, by the way, Clayton, capturing much of the mainstream media, right? Funding media. So people are only getting one version of the truth, which really isn't even the truth. It's misleading information. And if they knew the whole story, the whole picture, that would completely change their decision-making process, certainly on the vaccine in this case, but many health decisions. And until we address this head on, Clayton, this problem is only going to get worse.
And I think another big piece of this, when we talk about big media, is big tech, right? Most of Washington is now run from Silicon Valley, and a lot of the media is born out of Google, out of Facebook, out of Twitter. So big tech, of course, has been suppressing the truth around these vaccines. The reason, in fact, that we're even doing this interview on Rumble is because YouTube would ban us from their platform to have an unedited version of this interview. In fact, here's YouTube's terms of service from this morning. I checked before we did this interview. So this is currently what you're allowed to say on YouTube about COVID and the vaccines. I want to read it to you and get your response on a few of these points, Doctor. The first one, statements about COVID-19 vaccines are contrary to the consensus of experts from local health authorities or the WHO. So if you say something that's contradictory to them, they will take your content down and block you. Another thing they say, claims that approved vaccines against COVID-19 cause death, infertility, abortions, autism, or contamination by other infectious diseases. So that's just point one, Doctor. Take that one. You can't say anything about that.
Yeah, and it's extraordinary, isn't it? But then again, it's not surprising, Clayton, when people understand the root cause of the misinformation mess, the medical misinformation mess.